So my name is Gail McNeil, and I'm a nurse and certified diabetes educator and the host for today's webinar. There's no doubt that this pandemic has disrupted the world, but especially so for those living with diabetes. It's created anxiety, stress, and many, many questions. In fact, today's webinar, sponsored Diabetes Care Community, has been overwhelmed with questions from their visitors and their members about COVID-19 and its impact on their personal care. In a continuing effort to answer these questions, Diabetes Care Community has published many articles on the subject, and these can be found at the Diabetes Care Community website. For those who are not familiar with Diabetes Care Community, this is an online publisher focused on providing knowledge and skills to people living with diabetes. So we've gathered today an expert panel to answer some of your questions. We can't do them all, but some of your questions about COVID-19. So let me introduce our expert panel, and I'll start with Dr. Lana Wiseman. If you could introduce yourself.
Hi there.
And where do you work, and who are you?
Sorry. So I'm Alana Wiseman. I'm an endocrinologist at Mount Sinai Hospital in Toronto. I also spend a significant proportion of my time doing diabetes research.
Thank you, Alana. And Dr. Barry Simon.
Hi, I'm a psychiatrist at Mount Sinai Hospital, and I'm the psychiatric consultant to the departmentology there.
Great. And Barbara Cleve.
Hi, I'm a clinical nurse specialist working at the Leadership Sinai Center for Diabetes. Thank you for having me.
Well, thank you for joining us today. So also, just to remind you, please put your questions in, okay? Because we have some questions that we've gathered, but we're here to answer some of your questions right now as well. So we're going to start with a very broad opening question. And it came in, what should someone living with diabetes know about COVID-19? Are there complications we should know about? What's the importance of keeping our blood glucose controlled? Alana, I'm going to ask you that question to start with.
Yeah, so I think you've alluded to the most important point for people with diabetes during this pandemic, and that's that diabetes is a risk factor for having more severe illness with COVID-19 or having more complications related to COVID-19. And so it's really important for everyone with diabetes to follow the general public health guidance and measures such as physical distancing, frequent hand hygiene, staying home or not being around others if not feeling well, and masks in appropriate situations. So it's all of the usual recommendations, but just of greater importance for people with diabetes to protect themselves. And then the other key point is that we have seen in some of the studies so far that for people with diabetes, blood sugars may be related to the risk of complications for COVID-19. And so this is a particular time to focus on trying to optimize blood sugar control. And if someone's blood sugars are not optimally controlled right now, then I would encourage them to reach out to their healthcare team and work on trying to make some changes to optimize their blood sugars.
Thank you. Dr. Simon, do you have anything to add about that? It's been an isolation time for a lot of people during this. Do you have something to add that what we should know about COVID-19 in regards to our mental health?
So in terms of the isolation, I think the first thing to say to people with diabetes, that in fact, they're dealing with the same stressors everybody else is. I've been speaking to people all day long about mental health issues, and diabetes, not diabetes, people are scared, they're feeling isolated and alone. I would stress that from a feeling of alone and not being feeling connected, it's very important to really go against that feeling and reach out to your healthcare providers and get information, especially if your blood sugars aren't ideal. So it's a matter of really telling yourself, I need to do this for my health.
Thank you. Well, that leads us into the next question. How can I be referred to a diabetes consultation? Can I ask Alana that one?
Yeah, so generally, I think the referral process to see a specialist in diabetes is similar as it was before the pandemic. And so generally, the diabetes education centers are still available. Those can be done through self-referral. In terms of seeing a specialist, that requires a referral from one's family physician. And so that process would still occur, although a lot of the visits are now being done virtually. So rather than someone seeing their family doctor in person, it might be a phone call or a video visit to arrange the referral. And then the appointment with the specialist may also be by video visit or by telephone consultation, although that's determined depending on where someone is living and the particular rates of COVID-19 in that area.
So we've had this question a lot, especially from our patients, that as people are ramping back up in services, do you think the virtual appointments are here to stay? Dr. Wiseman?
So I think most of us hope and believe that virtual care will be here to stay in some form, perhaps not to the extent that we're utilizing it right now. That is in some respect a government and a sort of healthcare system decision in terms of how much virtual care will be incorporated in the future. But I think, despite some of the challenges and some of the difficulties of virtual care, I think there's also been a lot of benefit, a lot of positives. We've heard some patients talk about how much they love it, how they don't want to come back and drive a distance to see their doctor, pay for parking, wait in the waiting room. So I think, there's definitely some benefits to virtual care, and I hope that we will be able to continue some component of virtual care in the future.
So I had a patient this morning, and she said she wanted an appointment with her doctor, a real one. Okay, she is tired of the virtual appointments, and so I will need to tell her that they may be here for a little while longer. Okay, so
yeah, and I think
yes.
Sorry, I was going to say, and I think optimally there would be some balance between in-person and between virtual care, and we may be slightly more tipped to virtual now than we would like, but I hope in the future we'll be able to find that balance.
Finding balance, I think, is a great idea. Exactly. I'm going to ask Barb, how should I prepare? How we should be telling our patients to prepare for virtual appointments or the telephone appointments?
Well, that's a great question. I think for any appointment, and especially virtual appointments, it's great if you make a list of any questions or concerns that you'd like to discuss with your healthcare team member prior to setting up your appointment. Have an up-to-date list of your medications and your insulin doses together with your blood glucose results. So sharing your blood glucose data with your healthcare team is important so you can work together to evaluate if your diabetes medications are working or if you need to change them. You can share these results in a variety of efficient ways for a virtual visit. If you write down your blood sugars in a logbook and usually bring them into your doctor, you can take a picture of it and email it through your cell phone to the office. Some blood glucose meters have the ability to download the results online to web-based platforms, and you can email those. Continuous glucose monitoring or flash glucose monitoring can upload the data to a website, and it can be shared with your healthcare team members. So you should really discuss all these options with the office before your appointment. I know many offices are emailing appointment reminders along with instructions on how best to share the blood glucose data with their team.
Okay, thank you. And Anna, do you have anything to add to that? Or?
Yeah, I think I agree with everything Barb said. I would add two additional things that can be helpful. One is having the pharmacy information on hand so that if your healthcare provider needs to renew or send a new prescription, that you can easily give that information. And then another key component for diabetes care often is blood pressure measurement. So if people do have home blood pressure monitors and they are monitoring their blood pressure, I often ask for a record or a log of those to be sent or ready to discuss as well, in addition to the blood sugars.
Okay. Here's another very popular question.
Yeah.
Sorry, yes, Barry. Mm-hmm.
I think people should take charge of their virtual appointments. One of the things I've found in working with people virtually is they get anxious by it initially. So I always say, write down your questions beforehand, because once they're facing you on Zoom or some other OTN platform, it's hard to remember what you wanted to ask.
Perfect. So write down your questions so that you'll remember them and you won't get too nervous to ask them. Excellent. Another popular question we've had is should I be going for routine blood work? And if so, where should I be going for my routine blood work at this point? Is it safe to go? Barb, do you have an answer to that one?
Yeah, so I think that everybody's been holding off on blood work during the thick of the pandemic, but it may be a good time to get your blood work done now as the number of cases of COVID are decreasing. But you need to check online or call ahead to your usual lab to see if it's open. I know that some locations have closed temporarily due to reduced volumes, but some labs are open. And the labs are encouraging patients to book an appointment online to minimize their waiting room time. And they're dealing with smaller volumes of patients, trying to keep people 2 meters apart, of course. The labs are well equipped with personal protective equipment and have these social distancing measures in place. And remember to bring your mask and wear it. And if you have urgent blood work, definitely do not put that off. And it might be better to do it now instead of waiting to fall or winter, where we may have a second wave of COVID. But it's also important to confirm with your doctor if you need to get routine lab work done. I know cholesterol tests are for once a year, and you may not need to get that. It's fine if it's delayed for a few months. Some of the continuous glucose monitoring data will give you an estimated A1C level. But if you're checking your blood sugars regularly, sometimes we can use that data instead of getting an A1C, and we can defer that for a little bit if necessary. So check with your doctor's office to see what lab work you should definitely do.
Great idea. So check with your doctor, see if you need it. Make an appointment and don't put off urgent work is what you're suggesting at this point. Yeah, great. Now, Alana, you've answered this one somewhat when you started to talk about the blood pressure, but how do you get blood pressure monitoring and management support? It's one thing to have our meters and things at home, but what about blood pressure?
Yeah, so for people in whom blood pressure monitoring is, very important or essential, for adjusting the medications frequently, or there's been difficulties with controlling the blood pressure, it might be worthwhile to look into getting a home blood pressure monitor if you don't already have one. And there is the website for Hypertension Canada that has some information about home blood pressure monitors. And so if you have one of those devices, that can be very useful. It does become a bit more challenging if you don't have a home blood pressure monitor, because my usual go-to would be to check at a pharmacy. But that's not being done now because of concerns with contamination and needing to clean between people. So that's not really a great option during COVID-19. So for people who do need frequent blood pressure monitoring or adjustment, if they're not able to measure at home, they should be speaking with their physician, either their family physician or primary care provider, or their diabetes specialist. It may mean they need some in-office visits to get their blood pressure checked, and so that should be discussed.
Okay. Now, we're always worried in diabetes too about other complications, particularly about the foot and the eye and dental care. Do you have any suggestions about how we can go about getting the foot care, eye care, and dental care done in this COVID era? I'll ask Alana that one.
Yeah, so I like to think about all of these questions, and I think about it the same way with the blood work, like Barb was discussing, in terms of the person's risk, and that's based on their age, the status of their diabetes, what complications they may or may not have, and how well their blood sugars are controlled. So that's the risk of the individual, and then the risk of the activity. So, for example, going to the dentist might be higher risk than getting blood work or getting foot care. And so I think that both of those perspectives need to be considered when determining the overall risk of going for these sort of routine care or preventative care appointments. And like Barb said with blood work, anything that's needed to be done, there's an urgent issue, for dentistry, if there's some concern about infection or pain or a symptom that needs to be addressed, I would not put those things off. What we don't want to happen is things to become worse because someone hasn't gotten care at the time that they usually would have gone for care. And then, in situations where it's needed, I think the benefits outweigh the risks. For people where it's really preventative, like just a regular foot exam, but they don't have any history of neuropathy or any foot issues, again, and same with the eye exams, if there's no history of retinopathy and they're just going for regular screening, it's worthwhile discussing with your healthcare team whether those things can be delayed for some time. And again, it's also worth considering we're in a time now where COVID cases are on the decline. So maybe it is the time to go and do some of those things and try to avoid having to do them potentially during an increased risk of infections as we move into the fall and winter. So there actually have been some guidelines put out for virtual care for type 2 diabetes, for example, and they have suggested that in people with no history of retinopathy, we can probably delay regular eye exams from yearly to every 2 to 3 years, depending on their history. So it's worthwhile discussing this with your healthcare team to make an individualized decision.
Okay, thank you. One thing I was really scared about with a lot of my patients is the foot care, where they would go every 6 weeks. And a lot of the centers have opened up again. And I would encourage, if you've been having foot care done, please phone the centers, make an appointment. And again, all the social distancing, like washing your hands, but it's essential for a lot of our patients to have the foot care. So that's a great idea about our physical care. What about our mental health, though? Dr. Simon, what is available and what type of support is available for mental health issues, like dealing with our stress, anxiety, and in some cases, depression?
Okay, so in terms of potential ways of getting support, I guess first of all, virtually you can get support. There are a lot of reputable sites that you can get information about anxiety and depression and stress management. And then if you want to actually, start implementing a plan, I think it's really helpful during these times uh, to have two things as being primary. One is to practice some form of relaxation, meditation, taking time if you are going outside and feeling safe about it to walk in nature. All of those things reduce stress and anxiety of the everyday nature, and a lot of people are feeling that. In terms of meditation, if you want to learn it, you can learn it through apps. There's apps like Headspace, Calm, Insight Timer are a few that, and they're actually mentioned on the Diabetes Care Community website. Also, I think it's very important to deal with those if they're not reached the point of reaching out to your family doctor, which I'll talk about in a moment, is deciding that everybody's feeling it and that you want to reach out to others. Because under stress, people fall into, fight and flight. And the flight part of it is to retreat from your world, to just not want to connect to others. And I would say the best treatment for those is actually doing the opposite, to reach out to supportive friends, to go on to sites like Diabetes Care Community and getting support just by reading through information, finding out the facts. Finally, if you've reached the point where you're actually having mental health issues, I think it's no different than non-COVID time. You reach out to your family physician and speak to them about what are the resources available for mental health consultation, meaning seeing a psychiatrist, and if you're in a family health team where there's actually social workers, getting an opportunity to speak to someone and let your family doctor be involved in making the determination if it's gone from everyday anxiety and depression into something that's important to actually get a mental health professional involved.
Thank you. So relaxing, connecting, and if you feel really necessary, you're having big problems, is to connect with your family doctor. Thank you. A lot of people have been asking, how can I prevent getting COVID and what are my risks, et cetera, et cetera. So, Len, I'm going to ask you this question. How can I lower my risk of getting COVID-19 and lower the chance of getting complications?
Yep. So I think first important to highlight is that we do not believe that people with diabetes are at a higher risk of actually contracting COVID-19 than someone without diabetes. So I think that's really important to note first and foremost. Um, and so in terms of preventing COVID, it's really the same precautions that has been the public health guidance that we've been hearing so much about. So it's, physical distancing, limiting the number of individuals you have close contact with, wearing a mask when you're in a high risk setting, frequent hand hygiene. And again, staying home if you're feeling unwell, and everyone around you should be doing the same as well. So there's really nothing special for people with diabetes to do in terms of minimizing the risk of contracting COVID-19. As I mentioned earlier, there is a higher risk of having more severe illness or having complications like needing to be hospitalized for COVID-19, or needing to have a ventilator or be in the ICU, for example. And there are a few factors that may be modifiable in terms of lowering that risk. So one I mentioned earlier was blood sugar control. There have been some studies that have indicated that people with poorly controlled blood sugars may be at higher risk of complications. And so this is a time that people can really focus on trying to optimize their blood sugars, and achieve their hemoglobin A1C target if they're not currently there. Another factor is that for people who are overweight or obese, this is also a risk factor for having more severe COVID-19 or complications. And so I don't recommend drastic changes at this time, especially during an era of virtual care when you may not be as connected with your healthcare team. But making small changes to promote a healthy lifestyle, such as increasing your physical activity, and trying to reduce some weight if you are overweight or obese, may also be helpful in reducing the risk of complications. And if you are making substantial changes, either with your blood sugar control or with your lifestyle, I would always encourage you again to reach out to your healthcare team and talk these through, because there may be some medication adjustments that would need to be made, or there may be other counseling that would be provided.
Thank you, Alana. Well, this next question leads right into the healthcare person, the diabetes educator, which I'm going to ask Barb. And following on from Alana's question, what are some tips for maintaining healthy eating and regular exercise during COVID-19? Let's hear from the diabetes educator.
Yeah, so we've all had our lives turned upside down with this pandemic. It's drastically changed all our healthy behaviors. Although some people have embraced it with cooking more at home and eating healthier, while others have ordered in with less healthy options and maybe craved comfort foods or baking treats for the family and helping themselves a little too much. So maintaining healthy behaviors does take some energy. And as Dr. Simon mentioned, when we're feeling stressed, it's easy for us to fall off track. So the first step to relapse prevention and resuming healthy behaviors is to take a close look at what's worked for you in the past to help keep you on track with your healthy diet and activity. It's also important to acknowledge that this is really unprecedented time of change in our lives, but you can get back on track and find sort of a new modified healthy routine while you're maintaining your social distancing. So try to start with one small realistic change. Pick something that's really important to you that you want to work on. But it also has to be something that you have full control over. And give it time. Feel free to get support from others if possible. Some people like to do things on their own. Others like to do it together with a friend. So if you talk with a friend or your healthcare team about it, that sometimes helps keep you motivated and keep moving towards it. Keeping active in this time when all people's sports have been canceled and they can't go to the gym, etc., has made it really difficult. So some of the people that I've been speaking to have been trying new things to stay active since the gyms are closed. They're exercising outdoors, walking and biking and swimming, getting support with exercise, doing it together with family or people from their social group that they're allowed to be near. Sometimes you just want to have a little me time and do some solitary activities. There's so many free online yoga and fitness videos and classes that are available right now. Many are offering these free online groups in order to get new users for after the pandemic. So make sure you take advantage of the opportunity to try some of these new things. Home resistance training ideas, they're available online as well. Exercising with water jugs, or if you're at my speed, soup cans. Those are a lot of ideas are available on Diabetes Care Community website as well.
Well, thank you, Barb. And I heard you very clearly. Take a small change and take something that you think you can do and achieve and work with it. Now, you did say something really interesting about taking things that you are in control of. Dr. Simon, I'm going to ask you this question because we're not always in control of this aspect of our lives. How can I deal with the stress, anxiety, and the concerns of returning to work in school if I have diabetes?
Okay, so I think the first thing to do is to listen to what uh, you've heard from Alana today. You've heard from Barb talking about it. Those are the basic things you can do. And I think it's really important when I'm dealing with people with anxiety, they always tell me the things they can't do, and they tell me all the things that are out of their control. And you really heard enough of a list from the two of them that you can do to control and get yourself protected and safe. So that should keep people pretty busy. About going out in the world, I think it really is, if you're really focused on the basic social distancing, regular hand washing, trying to also, I find this is reminding other people about social distancing. I have a dog, and when I go walking for a dog, it seems like that's the moment that people want to come up and chat with you, and it's in a nice way reminding people. So taking control of that as well. When it actually comes to going back to work, I think that it's going to be this way. Workplaces are going to have to accommodate people. They're going to have to respond to each person's risk. It's going to be mandated, and it is mandated by government. So people need to feel strong about standing up for what their specific risk profile, checking it out with the nurse, with their physician, to seeing, am I safe to go back to work? That's a reasonable question, I think, if you have diabetes and complications, and if your age then becomes a factor. You want to do all of that to regain a sense of control. And going back to also the final thing is working as a family. If you live in a family unit, making sure everybody's on board, because you can have young people who feel fearless and nothing can get them, but you just have to remind them as a unit, one person gets it, everybody gets it potentially. And working as a family unit can also provide people with some support.
Thank you. We're in this together, in other words, right? Exactly.
I think that's a good line.
So, that's good. So a lot of people have been asking what the future might look like, and we can't predict that. I know that, but we've got an expert panel here, so we're going to be asking the experts their opinions. So Len, I'm going to ask you the first one. What is your opinion on the possible second wave of COVID-19, and how do you think it will affect us? Similar to the first wave? Different? What's your opinion?
Yeah, so I think there will be, again, this is very hard to predict. So I think we have to hope for the best, but prepare for the worst case scenario so that we are prepared. And I expect moving forward that we will see times where cases are increasing. And, as we're seeing most of the provinces now moving into reopening phases, and the prospect of school beginning in the fall, which I think is a big factor. And we still don't know quite how school will look in a lot of Canada. So I do think we will see times where cases are increasing. So we need to prepare ourselves for that. I think there will be regional variation, as we have seen so far. So, what's happening in one area of a province or of Canada will likely differ than other areas or provinces. And so it's important to be aware of the rates of infection in your area and the recommendations from your local public health unit and your provincial guidance, because that could differ from other areas. And I hope that we've built up an infrastructure in terms of testing, contact tracing, and isolating, that we can avoid a big surge or any type of infection rate that will overwhelm our hospital capacity, which is what everyone is particularly worried about. So my best guess of the future will be that, we'll see these bumps up in cases, and then hopefully coming back down. That may go along with some more restrictions coming back in terms of closures of some businesses that have already been open. But I hope we'll avoid a big surge like we've seen in other areas of the world where healthcare was really overwhelmed.
So you think a second wave will probably come, but we'll be better prepared and we'll probably handle it a little bit better. Okay.
I hope so. Positive. Yeah, if you look at history, I mean, there's been really no pandemic that hasn't had a second wave.
I
So
heard
that's why
that.
I think that's why we need to prepare for the worst. But we're also in a more modern time. We have the ability to test like hasn't been possible in previous pandemics. And so I hope we can, influence the course of this pandemic and change the history. And I think we are well poised to do that.
And learn from experience. I hope that's what we can do is take experience forward. Which brings us to another
Absolutely.
question. We've answered this somewhat and talked about it. But what will the future of diabetes care look like? Barb, let me start with you with that one. What do you think the future of diabetes care will look like from your perspective as a healthcare provider?
Right. So I think that we hope to have more in-person visits begin to take place. And I think we should be prepared for a combination of both office visits as well as virtual appointments to continue. We're going to need, especially initially, to keep the number of people in the diabetes centers and in the clinics to a lower number. Um, and so virtual appointments will need to continue in order to meet everybody's needs. Just like we have smaller numbers that are allowed in the grocery store, that's going to be monitored. And prior to attending an in-person diabetes visit, you'll need to confirm that you're feeling well and that you don't have any COVID symptoms and that you haven't been exposed to anybody with COVID or awaiting any COVID screening results. And it will be mandatory for you to wear a mask when you come in for your appointment and to wash your hands before and after you enter and leave the building and during your time if that's appropriate. And also to maintain 2 meters from others as much as possible while you're in the diabetes clinic. So in order to serve all our clients, we're going to have to do a combination of virtual visits and in-office visits.
Office visits. Great, thank you. I find with the patients, when you're standing 6 feet apart, they don't really understand that because they're used to being so much closer. It's a new norm to get used to. Alana, do you have anything else to add to that as to what the future of diabetes care will look like?
Yeah, so I always talk about flexibility, and I think we all need to be flexible, healthcare providers and patients alike, as we move
Mm-hmm.
forward. So when I'm scheduling my follow-up appointments now for people with diabetes, I'm telling them, I don't know if it will be virtual or in person. We're going to have to let you know closer to that date as we approach that time. And so I think we need to be flexible that we'll have to be deciding, appointment type between virtual or in person might change depending on the circumstances. As I mentioned, there may be a time where infections are increasing, and we might have to go back to all virtual care. So I think the key is to be flexible, and within that constraint, we want to deliver the best quality care, whether it's virtual or whether it's in person. And I'll add just one more point. I think we always should be conscious of healthcare resources. There's been this big campaign in Canada, choosing wisely, in terms of choosing tests that are, only the ones that really need to be done, that are going to influence the care we're providing. And for me, I think this time has really emphasized that. So we're really trying to focus on high value, quality care. We may, outside of the pandemic, order more blood tests than are really necessary, or order other types of tests that we may want to do but really aren't critical. And I think this time has really caused us to focus on what's really needed for high quality care. And I think that's one benefit that we've actually seen. And hopefully we can carry that forward in the future with diabetes care, even after this has resolved.
So we've gained an awareness of what really needs to get done and what we can put back. Right. Now, one word you
Exactly.
mentioned is flexibility. And I'm going to go Dr. Simon with this one. Flexibility, when some people would increase anxiety if I don't know exactly what's going to happen. So do you have any tips as to how to stay motivated and stay calm and relaxed in this kind of atmosphere that we're in right now?
Well, I would stick with what some of the things I've mentioned already. I think about people are talking a lot about relaxation, meditation. Those are all important. Activity is really important. I think during this time, people have become I think some of the weight gain has been from inactivity, and I think it's really important to get out and exercise, and that's another way to gain flexibility. I think another one also is going to be in the future with more and more virtual care. I think there's going to be more and more virtual communities where people are going to come to and talk about their issues. As people get more and more comfortable online, I'm hoping that we're going to see places where people can actually go and ask questions, either of and of professionals as well,
Mhm.
as people's comfort level goes up.
Really interesting is things have changed and we have to get used to this virtual idea. And one of the terms I hear keep you saying is sort of relax and sort of be kind to yourself. And we are going through times that we've never seen before, and it does take time for us to get used to this and work with it. So we've come to the end of our actual questions that we've had set out here. Just I want to have a final word, if any final words on advice of how to stay healthy, both mentally and physically, with the continuing lifestyle changes we are expecting due to COVID-19. Any last words that you would like to share with us? Oh.
I would,
Alana, do you
I
have,
don't know,
would
how
you
about
like to start, or who would like to start? Mhm.
Lana?
Oh, sure. I think my main message is that, we hope that COVID-19 will be over quickly. But in reality, I think it will be with us for some time. And so remembering that this is a marathon, not a sprint. And I think, the first month or two, it was sort of this shock and a lot of stress related to the unknown. And I think now as we've sort of adjusted to this new normal, trying to develop habits that will be conducive to that in the long run. So trying to, as we've mentioned already, trying to incorporate some physical activity within this new normal lifestyle, trying to incorporate a healthy diet within this new normal lifestyle. So I think it's really just adapting habits for this new normal that will be here with us for quite some time, and learning how to sort of live with this for quite a while.
Okay, thank you. How to live
I,
with
I,
it. It is
I
here
would
to stay. Yes, yes, Barry.
I would say that I say there's a couple of things I want people to walk away with. One is, we're seeing more and more mental health issues as a result of this, and I think that we need to take that very seriously. Only a small percentage of the population in Canada are going to suffer the serious complications of COVID, but a large percentage are going to have the mental health issues associated with it. And I want people to take it seriously. If they're developing anxiety that's resulting in them not sleeping, having panic attacks with their heart racing, or feeling really depressed, reach out to their healthcare providers and let them know, because this kind of stress is the very stress that worsens mental health. And on an everyday level, I would say to people that once you've come to terms with this is here to stay for a while, I would have them implement what I call my 3 C's for relieving stress. Number one, connecting to others. So reach out to friends and family. I've heard people say to me they've contacted people from high school that they haven't seen in 30 years, just as an opportunity to reach out. The second thing is contribution. It's very helpful to get out of your own head and your own concerns and check in on others, helping others, reaching out to others, and finally, some aspect of creativity. Just because you're home, there's new skills you can learn that you never have learned or not practiced in a long time and said, I want to finally learn it. Well, if we're home more, here's the opportunity to have those creative aspects being in your life again.
Wow. So connect, contribute, and be creative. Thank you. I love those 3 C's. We can remember that one. Barb, would you have any final words for us, or how are we going to live and what we can be doing in our new normal?
Well, my thoughts were very similar to what was already mentioned. Be kind to yourself, reach out to your diabetes team if necessary. We're here to help. Help others if needed and if possible, and stay connected to family and friends as much as possible while you're maintaining the public health recommendations.
Great. Well, thank you. Those are the questions that were initially put in that we have had the experts answer. We've had a few more questions coming in while we've been talking on the webinar. So if the panel would have some patience with me, can we just work with some of these questions if that's okay? So here's one. Now I'll just send these out. Whoever thinks that they can answer it, please do so. The question is, I've attended an MD appointment in person Am I not supposed to see my doctor, or do I need to do virtual visits? Who would like to answer that one?
I can answer. I can start
Okay.
answering that one at least. So I think, if you've seen your physician, and your physician has decided to bring you in for an in-person visit, you shouldn't feel like you have to question that just because there is so much virtual care going on. So throughout the entire time, even when we were sort of doing almost all of our outpatient care virtually, there was always the proviso that if someone needed to be seen in person, we would absolutely do that. We don't want to sacrifice the quality of care. And so if there was an assessment that needed to be done in person, we were doing that, wearing the appropriate personal protective equipment in place. As things have started to open up, I think there's been a lot of regional variation in terms of the reopening of outpatient care. And so in some areas, physicians or healthcare providers might be doing more in-person visits than they are in other places. So there is some variability in that. And if your healthcare team has arranged an in-person visit, I think that's totally reasonable. If you feel like you went to an in-person visit and you think it could have been addressed virtually, then I would encourage you to ask your healthcare provider about virtual options for the next appointment. Because I think for the most part across Canada, most healthcare providers are now able to do phone appointments or video visits with different platforms.
Okay, so it's sort of a matter of choice and circumstance and who's ready to do what in whatever they're calling you for. So as Dr. Simon said, we need to be flexible at this point in the time. Great, thank you. Okay, we had another question. How often should you get your glucose monitor checked for accuracy? Should you get a new one each year? I'm going to put that one to the diabetes educator. How's that?
Oh, that's great. So I don't usually recommend that you get a new meter every year. When you go for your routine lab work, we do like to do a lab meter comparison to make sure that your results are accurate within the acceptable 15% variability that we expect from a lab to meter comparison. And if the results are off, then definitely you likely need a new meter. But often people have their meters for 2 or 3 years or longer. If they're getting good results, it doesn't necessarily mean they need to be changed. So don't panic if you've had a meter a little bit longer and think, oh my heavens, I need a new one. This one's no good. So it's really just depends.
Okay, so
wishy-washy answer.
here. Okay, and another question. Oh, this is interesting. What do you hear about a vaccine being made available? 6 months, a year, 18 months? Alana, I know you've been looking into this, Alana. What's your answer to that one?
Yeah, so that's a very timely question because there was actually just a big study released today about one of the vaccine candidates. And so we actually have quite a few vaccines now that have shown some promising early results. But these studies so far have mostly looked at safety of the vaccine rather than, does it work in a large number of people. So we've had very promising results that some vaccine candidates appear to be safe in the small numbers that they've been studied in so far, and they appear to induce antibodies that would be protective. So far everything looks very promising. This is the most rapid development that has ever occurred in history on a vaccine. And so, the best estimates I've seen, I'm not directly involved in vaccine research myself, but the best estimates I've seen are, end of 2020, early 2021, that we're hoping for a vaccine. And then I think the biggest concern actually is not so much developing a vaccine that works, but how do we mass produce billions of doses that would be needed, and how do we distribute those and administer those? There may be early on, we only are able to vaccinate certain populations, and we'll have to figure out who those people are. And then how do we get the vaccine to the broader population? So again, I think this is a marathon, not a sprint. We hope, it seems like all signs are pointing toward that we will get there, but it will take time. And this is the fastest it's ever been done.
And that's encouraging because we'd heard at least 18 months, which would take us a lot later in 2021. So you're encouraging. I also heard a comment, which I just wanted to ask about. They said that we had to actually vaccinate about 75% of the population to really not cure, but get rid of COVID substantially. Is that true, or what's the story behind that?
So that's getting at the concept of herd immunity, which we think about for a lot of vaccines that we already have. So for things like measles, for example. And so that's the percentage of the population that needs to be immune in order for the pandemic essentially to resolve, for there to not be transmission anymore, because the likelihood of encountering a person who's susceptible is very low. And my understanding is that it differs for different infections. And so there have been some hypotheses that it might actually be lower for COVID-19. And some of that has to do with the age distribution. You know, we're seeing this age being a huge factor for severity of COVID-19. And so, you know, I think we don't have an exact number yet. We don't know that yet. Hopefully there will be future research that can clarify that moving forward. But even if we're talking about 45% of the population, 45% or higher of the population, that's still huge numbers of vaccines that need to be produced. And we're also, I think most of the candidates so far have actually looked at 2-dose vaccines as well. So it's more than 1 dose per person.
Wow. Well, thank you for explaining that. That's useful. Another question. For those of us recently diagnosed, should we expect long waits to finally see an endocrinologist? Is there a bigger risk for the newly diagnosed if they aren't getting any of the usual medication and tests? Okay, who would like to tackle that one?
I can start. Maybe Barb can jump in for the second part after. But in terms of wait times, I hope that it shouldn't be the case that wait times were affected. Certainly for other aspects of healthcare, like surgical procedures, you know, there is this backlog that's going to need to be addressed. But fortunately for us, diabetes is actually fairly conducive to virtual care. And so I think most healthcare providers and diabetes have been able to maintain the frequency of appointments, and even seeing new referrals or new consultations through virtual care means. And so I don't think that our wait times should have really gone up because of this. I know mine personally have not. There are a lot of patients I haven't ever met in person, and so there will be a backlog in terms of trying to eventually meet people face to face. But I don't think in general the wait times should have suffered. And I'm not sure if Barb wants to jump in terms of the education aspect for newly diagnosed people.
Thanks, Alana. So Dr. Wiseman has referred patients to me for education, and we've done virtual visits. I know some diabetes centers that do group appointments have done sort of Zoom meetings and have done education in groups, changed platforms to virtual visits. I've done insulin initiation numerous times now via video education, and it's gone quite well. People are very comfortable with it, and we've used a lot of different resources, and I think it's a great learning experience for me. And I think it's something that I would continue to do even if people are free to come back into the office. I think we should keep this option of virtual education as well.
And I think the community programs where a lot of the newly diagnosed patients go are open and doing these virtual groups as well. So please contact your local community areas, and the education programs are still ongoing, okay? Although in a different format, not physically at the location, but definitely virtually. And they're doing a lot of in-person individualized appointments too. So I would strongly encourage, if you've been newly diagnosed with diabetes, seek out your local community center, because some of those are referral centers that you can do yourself. You don't even need a physician referral for them. So, and the other thing is, if you're looking for a center close to yourself, the number 1-800-BANTING, if you phone that number, it's Diabetes Canada, they can actually hook you up with the closest diabetes center for you. Okay.
And
So
I'll just
they're
also
still
add,
ongoing.
I'll also
Yes.
add for patients with newly diagnosed diabetes that of course there are also online resources. So on the diabetes care community website, there are lots of resources, as well as other websites that have evidence-based recommendations as well. So there's also the opportunity to read online.
Yes, a lot of information. That's what the diabetes care community is all about, is informing people with diabetes. So so here's another question. How long does it take to lower blood sugar by using dietary changes alone? Well, that's an interesting question. Some of these questions they're getting more difficult. Do you see the trend to the questions getting more difficult? So who would like to start answering that question?
Well, maybe I'll start. I think it really depends on how much change you can make in your diet or how much change you need to make in your diet. So I've seen people with very high blood sugars and they're able to make really significant changes in their diet and improve their blood sugars quite a bit. It also depends on where they're at in their, if their diet's pretty good already, making a small number of changes may not have as big an impact. And it also depends on how long you've had diabetes in terms of how sort of nimble your pancreas is to recover. If you're early in your diabetes, you may be able to get your blood sugars back down the normal range fairly easily by making changes with diet and exercise. But if you're much later in the history of your diabetes development, it's a little bit harder and you may need more and more medication to help your pancreas. That's just the natural progression of diabetes. Alana, would you like to add anything to that?
Yeah.
Sure, I would add, our main measure for blood sugar control in people with diabetes has been the hemoglobin A1C. There's been some controversy more recently about using other measures like time in range. But if we talk about hemoglobin A1C, it is a 3-month average of your blood sugars. So it's important to keep that in mind because if you're making substantial changes and your blood sugars come down, the hemoglobin A1C test will lag because it is still reflecting some of the blood sugars from up to 3 months ago. So not to be discouraged by lagging changes in terms of that measure. But in terms of the blood sugar measurements you're doing at home, either by poking your fingers or if you're using a glucose monitor, those can be seen quite quickly. And I think people with diabetes who are monitoring their blood sugars frequently, they will see that they can see a rise with certain foods. So you can see that quite quickly, and that can actually help with reinforcing which dietary changes have been positive if you do see those changes.
So a good component to testing, very important to do the testing to see what the difference is. Okay, a couple more questions here. Where can I find virtual help for managing my weight? I'm going to let Dr. Simon answer that one because I know he used to be working with weight factors a lot in his practice.
So let's start with whether we're talking about type 1 or type 2 diabetes. So I'll address type 2 diabetes because I think that's a place where you can get a lot of virtual assistance. Many of my patients, and I still do see people with weight issues, will find very helpful these days to be on Weight Watchers. It's the new plan feels very reasonable if you have type 2 diabetes. You want to add in the recommendations of a diabetes educator to fine tune it, or a dietitian, but that's very helpful. And I think there's a lot of other apps that can be helpful just to monitor. Monitoring is everything in terms of weight management. If you know what you're eating and actually quantifying it, writing it down, just the very act of doing that changes behavior. So I always stress to people, if you really want to get started, find an app where you can write down both quantity, quality, and have it scored for you on a regular basis. That's my tip.
Okay, thank you. Oh, you get the tough ones, okay? Okay, it seems like there is a shortage of diabetes clinics and doctors to see new patients with diabetes, yet they are the gatekeepers for insulin, medications, etc. So we chatted with this one a bit. Would you like to just follow up a little bit on that one, Alana?
Sure. I think, there's a lot of regional variation in this across Canada. So I imagine the availability of specialists in diabetes will differ. And if you're in an area where you think there is limited access, I would encourage you to talk first with your primary care provider, whether that's a family physician or a nurse practitioner, and first assess the need to see a specialist, because a lot of primary care providers do diabetes care. They actually provide diabetes care for the majority of patients, there's a lot more primary care providers than endocrinologists or other diabetes specialists. So I would first go to that person. They can prescribe all the medications as well. With the greater emphasis on virtual care recently, I think there is also the opportunity there that perhaps, if there is a specialist, but they were located at a distance, an hour's drive or two away, you might have the opportunity now to do more virtual consultations. And so they may actually be more accessible than they were previously. And I'll just mention insulin specifically does not require a prescription. So, if people have coverage or insurance, they do need a prescription for insulin, but there is always the opportunity to buy insulin without a prescription because it is a life-saving or life-requiring medication. So just wanted to mention that point as well. But I would always encourage people to talk to their primary care provider about the need for a consultation and how to access that if they're concerned that there's limited access in their area.
Okay, thank you. Barb, I'm going to ask you a question because we've had a lot of questions from our patients about what is the best way to obtain diabetes medications and supplies. Can you address that one?
So there was some concern early on in the pandemic that people were only able to access 1 month's supply worth of medications initially. And I think there was some concern whether we were going to have access. We wanted to make sure that everybody was able to get their medication. Diabetes supplies were never at risk of shortages during the pandemic, and now pharmacies are dispensing 3 months supply again. There was a concern initially where people didn't want to go into pharmacies so often, and your pharmacy may provide delivery, or family member could go and pick up your medication for you if you're concerned about going into a pharmacy as well. And if your pharmacy doesn't deliver, you can have your prescription transferred to a pharmacy who will deliver. And then you'll see the pharmacies increase their delivery services if that's an important factor to their customers.
And then the physicians are sending in faxes, right, to the prescriptions to the pharmacy.
That's
so
right.
You really don't have to leave your door to do that. Great.
That's right.
Well, I'd like to thank our panel of experts here for this evening. And I'd like to thank the listeners for sending in those questions and giving us the opportunity to answer those questions. I hope it was really informative. This webinar is recorded, so you can actually look at it another time. And following this, there's a link to the survey because Diabetes Care community would love to have your feedback from today's webinar. I particularly like to thank our experts on the panel, Dr. Lana Wiseman, Dr. Barry Simon, and Barbara Cleve, for joining us today and spending your very valuable time with us. And thank you for all the work you've been doing during this COVID crisis. So take care and good night.